As you all know, tube current is one of the scan parameter which has a linear impact on radiation dose. So any percentage reduction in the tube current will translate to the same percentage reduction in the radiation dose to the patient. With dose modulation on an average size patient, with the adoption of the dose modulation, we see a significant reduction, nearly 50% or 30 to 50% reduction right off the bat. This is a dose modulation in the Z direction on a 6-year-old child, which also indicates the increase in the relative MA in the shoulder region because of the need for penetrating the thicker portion compared to the chest and abdomen. So, with respect to this dose modulation, there are a couple of points which I want to bring to your attention. With the technology right now, with the 64-slice scanner and so forth, what we are uniformly seeing across the board with any manufacturer with the 64-slice scanner, which we can comfortably say that dose modulation seems to be working quite well. So we can all feel comfortable for advising our physician colleague to use dose modulation technique on all adult patient without any concern on the 64-slice scanner. I still have some concern about the 16-slice and 4-slice scanner, because the dose modulation strategy started being adapted around after the 16-slice came into picture. So if some of the older models which has 4-slice, the dose modulation, you had to verify whether it's really impacting the change in the tube current. One of the best methods is like to have any chest phantom if you scan that across the board with and without dose modulation, and you examine the tube current with each of these slices right off the back, you need to see there should be a change in MA if it is working properly. With a 64-slice scanner, whether it is a GE, Toshiba, Philips or Siemens, what we are seeing